we've learned in the research we've done in our organization is that there really needs to be a patient interface. And a lot of the things that take up our time are having to do manual processes. So from my perspective, to the extent that automation technology can reduce the workload and the human resources efforts to ensure the safety of that medication use process, we can then leverage pharmacists and technicians to support patient care.
So if you walk into a lot of hospital pharmacies today, you'll see that we we spend a lot of our time performing fundamental services, and mostly within the actual department, you'll see that we're spending a lot of time doing daily operation things, checking trays, checking barcodes, handwriting things. So ideally, if we're able to streamline those processes and free up more time, pharmacists can play a more quality and cognitive role in providing direct patient care.
So I think that it helps us improve care and maintain the same level of care given increasing constraints on different sides. Properly deployed and calibrated technology can transform our care system. And it will have to if we're going to continue to provide care the way we do currently in the United States.
Technology and automation will allow us to remove some of the time we're spending on our manual process to really have that impact on patient care that we strive for as pharmacists.
I think automation and technology is key. It helps us gain efficiencies, and it allows some of the items that we do today and the processes that we do today with people. It allows us to replace not the people, but that job and that task with automation, and restructure in a way that we can provide more services than we do in the current model.
Well, I think it's integral to improve the technology because that's how we're going to get better. It gives us more view into what we could do to improve from what we're doing now to opportunities for what we can do in the future. As far as getting the product to the patient quicker, assuring that we save the time for the nurses so they really can spend the care at the bedside, and just having a better view into everything that's going on with the patient.
Technology in pharmacy, I think, is going to play a big role in helping us achieve our future vision and the direction that we're going. To allow our pharmacy technicians to practice at the top of their certification is allowing efficient technology that is both safe and accurate, and allowing them to take on more advanced roles within pharmacy. And that will help leverage our pharmacists to remove them from the basement pharmacy that's pretty typical right now, and having them placed at the bedside where they can have more interaction with patients and working through those clinical delivery processes.
Yeah, pharmacy automation will allow pharmacy to have more accurate checks using the technology, improving patient safety.
Oh, absolutely. I think if anything, we're going to continue to see more and more sophisticated technology where we can dispense patient-specific doses that can be tracked automatically. So in real time, we know where exactly our medication is. So we don't have to go chasing. I mean, the amount of hours we spend between pharmacy and nursing looking for the medications, if you just cut that down, we would have FTEs available just to do some additional services. So I think there's a lot of potential for technology, for continued growth of technology in healthcare.
That's the future driving state. I think everything that we're doing right now, technology or automation, is going to touch some point of the process, if not all of it. We minimized our ability for human error and having variations in processes when we standardize technology. So when we're looking forward to implementing different services or leveraging pharmacy resources to improve the patient care experience or creating more value, technology really drives our ROI, really drives our expectations and our outcomes, and we'll continue to use that to provide patient care and stay competitive within the market.
We're already at the point now where I'm having to decide, is it a better, safer thing for the patient to have a pharmacy technician make this IV? Or is it a better, safer thing to have a pharmacy buyer walk the shelves and buy something that they, on a gut feeling, think that we need? Or even in my daily practice, where I'm looking at things like, I need to know how much I'm paying for this today, tomorrow, what the average is going to be. Analytics is telling me, buy it today, because a month from now, you may not get that same price. 2 months from now, it may not even be available, let alone at this price.
Well, technology is going to continue to grow, and some of the technology that we're talking about at this meeting and that you have, I wish I had when I was in practice, probably back in the late 1990s, related to inventory management. But I think we've been waiting for a long time for this type of technology. I had a vice president of operations one time who was an industrial engineer, and he would talk to me and he said, anytime we can look at technology to advance our practice and help alleviate the use of individuals, in a process, we should always take a look at it. The goal is to alleviate labor in a process that could be replaced by technology. There's been significant strides in surgical procedures with robotics, and the improvement in care. A surgeon can't make an incision as well as a robot can. So we've already progressed in certain types of healthcare, and I think we're going to continue to progress.
It's going to be about telemedicine, and being able to connect with the patient when they come to your hospital, and then we discharge them home. Is being able to follow them at home, and that's really the key. I think telemedicine is the future of pharmacy and healthcare.
The role of technology, as has been evidenced over the last couple of decades in particular, is just tremendous. I mean, it's something that we not only have to embrace, but it's something that we have to learn to maximize in terms of the ways in which we utilize technology for the purposes of education, training, patient care delivery, clinical science, and so on and so forth. So, quite frankly, the sky's the limit when it comes to utilization of technology.